Why don't they love us anymore? And that's the question. The question that was asked, do y'all trust your doctors? And according to Pew Research, 56% say they have more mistrust or less trust in their doctor. 56% of Americans in this country don't really trust their doctor like that, yo. Man, like, of course, it hits me right here in the heart a little bit to know that the field that I'm in, half the people in this country don't even trust what we're saying, don't even trust what we're doing. And that 56%, when they start like talking to the minorities, Black and Hispanic folks, that number drops even lower. I mean, that number is even higher, I should say, right? So, like, this is a crisis. I don't know if you knew that over half the country don't really trust what you're saying. As a profession, you should be saying, hey, what do we need to do, right, to get over this hump? Because this is wild. I understand you having a favorability rate, maybe, at 10% don't trust y'all, 50%, that makes sense. But if 56% of people, according to Pew Research, says, like, yeah, I don't really trust the doctors like that, yeah, we should be raising an alarm. So we're going to talk today about why this mistrust is here, what we can do about it, and how can we get it to the point where the next time they do this survey, over half the country is like, no, we actually trust them now. All right, y'all know I love my numbers. So according to a Medscape report, many patients today feel like they're part of a conveyor belt system. How many times has it been described, especially as a patient, has it been described as almost like an assembly line process of care? And this is what their patients are peeping it, right? They're recognizing, right? And I gotta call folks out. They're recognizing that you are double booking them. You're squeezing them into offices. You're trying to nickel and dime them. You're marking up as much as you can mark up because the insurance is paying less and less and less. They recognize the game that's happening. They recognize that, like, hey, I'm not even, like, mind you, I took my half day, and we've given this scenario lots of time. I took the half day off of work, right, because I had to take a shower. I had to drive over here. I had to sit in your office. Even though I got here on time, I was still didn't get seen at my allotted time. And then when I do get back here, when I finally hit the promised land, you are 1 foot in and 1 foot out the door as you're talking to me, if you're even looking at me, because you're spending your time talking and typing away on a computer. Does that sound familiar? This is what the patients are experiencing. I always, when I see my physician colleagues kind of, do things that, and I'm a hospitalist, right? I'm a hospitalist. I'm a sniffist as well. So there's just certain like tactics and way you move when you're talking to a patient, when you're going to see that patient, even if it's a quick session that will show the patient, hey, even though I'm only here for 5 minutes, right, it's going to seem like 30 minutes, right? Because of the amount of attention I pour into you during that. There's simple ways to do it, right? I don't say simple. Physicians, if you need help, book me for a consultation. I'll help you, right? But there's simple ways to do these things, right? Where patients don't feel that you're just in and out the door before they even have the chance to say what is going on with them. So patients are feeling the brunt. A report showed that the average face time with a doctor is 13 to 15 minutes. I think that's good. A lot of patients don't think that's much. If you ask patients will assume that they get a lot less. But what the big key is, right, and I think this is important according to that report, patients feel that this is not enough time to build trust, answer all questions, or even explain a diagnosis clearly. Let me walk y'all down. If you're watching this on YouTube, make sure you're subscribed. If you're listening on a podcast, make sure you subscribe, hit the comment, 5-star. We love y'all. One of the biggest reasons why I started the Lunch and Learn with Dr. Barry it's been a long time, It's been a long time. But one of the reasons why I did it was I felt this way too. And I was the doctor. I was a doctor who felt I didn't have enough time to talk to my patients. I was the doctor who felt I didn't have enough time to explain the diagnosis. I was the doctor who felt that I was rushing in and out of rooms. And mind you, I used to give, and my bosses hated me, I had 20-minute appointments like built into my schedule. And you may be wondering, like, what's the difference between 20 and 15? Let me tell you the difference, since we're walking down memory lane with me, because I had a business consultant who tried to get me to change my ways, but I didn't want to hear it. If I have an hour, let's say an hour block, right? And I have 15-minute appointments, guess what? If I do everything like I'm supposed to do, I should be able to see 4 people in that hour, right? Y'all tracking me? Right? So 4 people within an hour. But if I have 20-minute appointments, guess what? Now I can only see 3 people in that hour. You may be thinking, all right, so what's the big deal? Now let's expand. If I work for 7 hours out the day, let's say 8, make it easier. If I work for 8 hours out of the day, the person who works and has 15-minute appointments, they see 8 more people than I see. May not be big, but that means by the end of the week, they see 40 more people than I see. May not be that big. That means that by the end of the month, they see 160 more people than I do. Now you see why it's big? Because if you're the boss, you're like, hey, that's 160 people we couldn't charge to be seen because you have 20-minute appointments. And that's just a 5-minute difference. Just so I want folks to kind of understand. Like, now, mind you, the person who has 15-minute appointments is still double booking. Can you think about that? The person who has 15 minutes appointments is still double booking. So it's not as if they give you all 15 minutes. Nah, hey, I'm sorry. I also booked someone else at, 8 o'clock as well. I've actually booked 3 y'all at 8 o'clock, even though I know it's impossible to see all 3 y'all at 8 o'clock. But I just figured like I could get through like this is what happens. Patients have peeped it a long time ago. Doctors have peeped it a long time ago. And trust me, doctors don't want to do it, but they understand if I see 160 patients less that much, that's less money that I'm able to bill insurance, which means less money that's coming back to me. And insurance is already paying me less. They're essentially paying me pennies to the dollar, right? So to speak, essentially paying pennies to the dollar. So I have to maximize it. Right? Because it's not like they're paying me a premium to see every single patient. Because if they did, I wouldn't squeeze 4+ in an hour. I wouldn't do that. But because I'm being squeezed from the top, insurance company, administration, I have to squeeze you, the consumer, aka the patient. And I say all this time in healthcare, the patients are customers. I know it may be wrong to call them a customer. I don't know why, but patients are customers. And for some reason, this is one of the few industries that treats the customers bad. And then we wonder why 56% of them don't trust us. We wonder why. Nearly 3 in 10 adults have experienced some form of discrimination during a visit. 3 in 10. Remember, we talked about this when we talked about AI. Part of the reason why people don't like the medical system, right, is because they've been discriminated in that medical system. Whether historically, whether concurrently, they've been discriminated within the system. So, of course, if the system has discriminated them, the perpetrators of that system, aka the doctors, right, are the discriminators as well. And I'm not going to trust you guys, right? I'm just not going to trust you. It's simple when you hear it from my mouth. But if you talk to physicians, they don't understand why patients don't like them. They don't understand why patients don't trust us. They can't fathom the reason why. And I just giving you 2 big reasons right off the bat, right? This is what I do. So when we think about not only are our patients tired of being put on a conveyor belt, they're tired of when they're put on a conveyor belt, they're being dismissed, they're being discriminated against, they're being ignored. All of this, right, within 15 minutes or less, right? Usually less. And then last but not least, the rise of misinformation. I talked about this before. The rise of misinformation that has allowed the public perception of who we are and how important we are to continue to widen. There are people here who don't trust in the science. There are people here who don't trust in medicine. There are people here who don't trust in the perpetrators of science and medicine, which is the doctors. That gap is getting wider. And the gap continues to get wider, right? Because we are not doing enough to close down the gap. One thing about me, y'all know me, shout out to my luncheoners. Y'all know that the second I see misinformation, I try to attack misinformation quickly because I recognize that in the year 2025, we're still fighting misinformation from a paper on autism and vaccine that happened decades ago because they didn't attack it quickly. So in 2025, I have to be as aggressive in attacking misinformation and disinformation now because I don't want in 2045 to my future physician colleagues to have to be arguing points like, is horse dewormer medication better than a vaccine? I don't want them to have to argue that. I'll argue that now for them. But again, that's where, the gap of trust, the trust gap has continued to widen. So now 56% of people, right, don't trust us. Right? Over half Americans don't trust us, right? The gap is just wider and wider. And it's wider because, again, these are just some of the easy factors that once you kind of understand, like those, you can kind of just put together the rest, right? Don't want to be on a conveyor belt. Don't trust the system that it is, right? Because they've been discriminated against and all this misinformation and disinformation that's out there, right? That is what is happening right now for the majority of the population here in this country. And that's why the majority of this population in this country don't trust their doctor. That's a problem. So where do we go from here, right? When we think about the fact that the mistrust gap continues to widen, it starts with transparency. We as physicians have to start being much open to our patients. We have to let our patients know, hey, this is what's happening. This is what's going on. We have to let them know, hey, like you may be overbooked. We have to start letting, because one thing, whenever our patients are in the dark, they start thinking, right? And one thing you know about me, or I love you to think, but once you start thinking and you start thinking negative, I have to try to reel you back in, right? So we have to be transparent in the hurdles that we are facing. Because again, I talked about this conveyor belt issue, the discrimination, misinformation. A lot of doctors are being burnt out right now. Rapid speeds. They're being burnt out because they're being overworked, right? They don't want to see more than 4 people an hour. Trust me. They don't want to have to be seeing 160 more people more than I did just because I had 20-minute appointments. But they had to do it. Why do they have to do it? And I just realized that not only did I have 20-minute appointments, I took Thursday afternoons off, right? Just so I can take Thursday afternoons off, right? Yeah, they hated me. But the reason why they do that is because they're not being paid, right? Like these, again, we talked about politics. The politics is causing their reimbursements to be lower and lower and lower. So they're nickel and diming you because that's how it always happens, right? When we talk about tariffs and we say, hey, yeah, you can raise the tariffs over here, they're just going to pass the buck down. So what's happening now is all of the lower payments, the lower reimbursements, the more workload is just being passed down to the patient, you, the customer, and you have to feel the brunt of it. You have to waste your half day in the office. You have to feel upset because now you've been double booked, right? So as physicians, we have to be open with this conversation, right? We have to be open and say, hey, this is what's going on. I apologize. This is what we're going to do to rectify the situation. Because just don't tell me a problem and don't tell me a solution. Y'all know me. Don't tell me a problem if you're not telling me a solution right behind it. That ain't going to fly, right? Research from the Mayo Clinic shows that shared decision-making increases patient satisfaction and health outcomes. And this is a big thing for me, right? And we talked before about kind of the different doctor-patient relationships. And the best one has always been the one where the decision-making seems like it's not necessarily a 50-50, but it seems like the other person had some like process in how we got here. When we talk about trust, building essential trust, if I, the physician, shows that, hey, I can trust you to be able to, give me feedback on your care and how to properly treat you, guess what? Like, my bond is here. People tell me all the time, man, Dr. Pierre, when are you going to get your outpatient practice, right? Because they can't fathom that I am such a good doctor, especially in this one-on-one, that I don't have an outpatient practice. Oh, I just go to rehab, just do hospital medicine. Because, and I think, and I definitely attribute the fact that I came up starting as an outpatient physician and recognizing the skills and traits you need as an outpatient physician and how important it is to be able to translate in the hospital setting, in the skilled nursing facility setting, in the rehab setting, right? They just understand, like, nah, this guy is different. He's not like the other hospitalist medicine guys, right? He doesn't run in and out. He's actually listening to me. He's actually giving me time to ask questions and giving me answers that I can actually understand and not over speaking me, right? He's actually doing things that a real doctor should be doing. And I hate to say a real doctor, but that's really what it is, right? If you are a proficient physician, you should be making sure that, almost like what's that, Inception, right? Is that Inception, that one Leonardo DiCaprio movie, where like you almost have to plant the idea in the patient to make it seem like the patient came with the idea. That is how good you should get when you're taking care of your patients. If you want that trust gap to lower, you got to make it so that your patients like trust you like your family. And a lot of y'all don't seem very familiar with like treating people like your family. And that is why the gap is widening. That is why they're running to misinformation more than they're running to you. I know some people who like follow this channel, even though I tell them, go to your doctor. I know some people follow this channel for health related content and news because they can't get it from their own primary care physician. That's a problem, y'all. I should be a supplement. I say this all the time. Because I'm not your doctor. I should be a supplement to what your doctor is saying. Hey, I heard Dr. Pierre say something like this. What do you think about? Oh, yeah. He was right, but maybe we should add this here because, I want a specific, like, that's what I should be. But there are some people who are like, all right, let me see what Dr. Pierre is saying about this. Oh, that's what's going on. Okay. Like, that's a problem, y'all. Like, we got to do better. We must do better if we want to, right? Again, I'm saying if, right? Because I don't know if some of y'all actually want to do it. If we want to close this gap, we are going to have to do better in closing said gap. Before I get out of here, one of the biggest pitfalls kind of in the discussion is the blame game. I'm not blaming you, doctor, right? Dr. So-and-so, I'm not blaming you. It's not your fault, right? I know it's all of these. I've already said there's so many different factors that are on top of you that are causing you not to do your job to the best of your ability of what you want to do it. Some of you are leaving the profession early because some of you are tired. I know with physician extenders and all these, like some of you I know you're upset, right? It's not your fault. Let me just tell you right now, it is not your fault. But it's still your responsibility to get something done. We still got to, at the end of the day, we went to medical school, residency. We're the chief head honchos, at least in the public's eye. We got to do better. So if we don't get anything else, right? If we don't get anything else from today's discussion, understand that I know that you are doing the best that you can, but for our patients out there, it is not enough. And we have to do more.